Hey, welcome back to the deep dive.
Good to be here.
For this deep dive, we're zoning in on just one document. It's an appointment schedule.
All right, from WA Peninsula Community Health Services, or PCHS.
And we're focusing specifically on the details for one person mentioned here, John Goodwin, born March.
That's him.
So our goal is pretty straightforward. Let's pull out the key info about his upcoming appointments from this single sheet.
Exactly. What does this schedule actually tell us about his care plan?
Okay, let's jump right in then. Looking at the schedule itself, what's the first appointment we see coming up for Mr. Goodwin?
All right, let me see. Okay, the first one listed here, the earliest date, is June 20th, 2025.
June 20th, got that. And the time?
10:30 a.m.
10:30 a.m. Okay, what kind of appointment is it? What does it say?
It's down as an office visit 15.
Office visit 15. Maybe 15 minutes.
Could be. And the provider is Anna Gonzalez. She's an ARNP.
An ARNP, Advanced Registered Nurse Practitioner. That's right, isn't it?
Yep, that's it.
So it sounds like a medical appointment.
Definitely a medical visit.
And where's this taking place, the location?
Okay, location is PCHS Silverdale Medical.
Silverdale Medical.
And they give the full address, 3100 NW Buckland Hill Road, Suite 202.
Suite 202. Pretty specific, so you know exactly where you're headed.
Yeah, no ambiguity there.
Right. So mid-morning, mid-June, a medical visit in Silverdale. Got it. What comes next on his schedule?
Okay, moving forward. Looks like the next entry is in July 3rd, 2025.
Okay, a couple weeks later, July 3rd, and the time.
This one's earlier, 8:30 a.m.
8 through euro. And looking at the description, this seems like a different kind of thing altogether.
Totally different. This isn't medical. It's listed as dental NP hygienist.
Dental NP hygienist.
The
Yeah.
provider is Quanta Anwar, RDH.
RDH, registered dental hygienist. So likely a cleaning, maybe a checkup.
Yeah, that would make sense. Focus on hygiene care with a dental specialist.
Now, here's something I noticed. The location for this dental visit, what does it say?
It says Silverdale Dental, but look at the address.
Exactly. 3100 NW Buckland Hill Road, Suite 202.
Wait,
That's the exact same address as the medical appointment. Same building, same suite number.
that's actually really interesting. Good catch.
Yeah. So what does that tell us?
Well, it strongly suggests that PCHS runs both their medical and dental services out of the same spot in Silverdale, co-located.
Which, for a patient like Mr. Goodwin, that could be pretty convenient, right? Needing different types of care, but it's all in one place.
Absolutely. Streamlines things potentially. You know the building already.
And think about this too. The document header actually says PCHS Kingston Medical.
Oh, right. I see that up top.
These appointments, they're in Silverdale.
So Kingston might be his, home-based clinic, maybe where the record originates.
Could be. It suggests PCHS manages scheduling across different sites. You might be registered in Kingston, but get care in Silverdale.
Which points to a more integrated system.
Yeah.
Coordinating care across different locations and different types of services.
Exactly. It's not just random dates. You've got medical with a nurse practitioner and dental hygiene with a hygienist.
Right.
Scheduled a couple of weeks apart, potentially managed centrally, but delivered locally in Silverdale.
Yeah, this simple schedule is actually, it's a small window into the logistics of running a community health service like this.
So let's recap the key takeaways for Mr. Goodwin, just based on this paper.
Okay, we've got 2 clear appointments. One medical, June 20th, 10:30 a.m., with ARNP Anna Gonzalez at Silverdale Medical.
Right, Suite 202.
Suite 202. And one dental, July 3rd, 8:30 a.m., with RDH Quanta Anwar at Silverdale Dental.
Also Suite 202.
Also Suite 202. So specific dates, times, provider types, locations all laid out.
It really highlights the practical details you need, doesn't it? Knowing it's an ARNP versus an RDH, knowing medical and dental share a space.
It gives you the who, what, when, where for each visit.
Which brings us to a final thought, maybe something to chew on.
Okay.
Just looking at these 2 entries on a simple schedule, think about the complexity behind it. The coordination needed. You need the right provider type available, the right facility, a medical exam room versus a dental chair.
Different equipment, different support staff probably.
Exactly. And potentially scheduling across different clinic sites like Kingston and Silverdale, all feeding into this one person's plan.
It's like a tiny snapshot of how a whole healthcare system has to mesh together just to make these 2 appointments happen for one patient.
Makes you appreciate the the quiet organization involved in managing healthcare across different needs and places. It's more than just dates on a page.
Definitely more than just dates. It's plan and action.